Dr. Judy Davidson, DNP, Class of 2008, is an evidence-based practice and research nurse liaison at the University of California, San Diego Health, Education, Development, and Research, and is the editor of the Journal of Nursing Management. Though known for her work with family-centered care and biomedical ethics, Judy's life shifted when nurses in her own organization have died of suicide. She began a quest to study the incidence of nurse suicide, risk factors, and the characteristics of the events. Simultaneously, she developed and tested a model for prevention of nurse suicide derived from what physicians had done before. This program has been sustained for 4 years and is now endorsed by the ANA as a model for suicide prevention in nursing. Her research continues during this coronavirus pandemic and offers evidence-based steps that facilities can implement to prevent and treat nurses with suicidal ideation. Quoted in the April 2020 issue of the American Heart Association News, Dr. Davidson said, "The stress is probably 100 times what you could have imagined it was in the past. Delivering psychological support to healthcare workers will be as crucial as providing the protective gear." She is currently co-chairing the American Nurses Association Strength Through Resilience Task Force. The task force is collating suicide prevention resources and resources to protect the mental health of nurses during COVID-19. From 2016 to 2020, she has been or is currently involved with no less than 9 research projects on a wide variety of topics. Dr. Tom Ortel, DNP, graduate of 2010, stated in his nomination letter, "I have known Dr. Judy Davidson for many years. What has impressed me most about her research and her career is that she has focused on the person, the family, the humanity of each nurse interaction. She looks at the distress and hardship of clinical nursing, particularly now during this pandemic. Judy's nursing research has an important place in the healing art of nursing. Dr. Davidson is, I believe, the quintessential nurse scientist." Please welcome Dr. Judy Davidson, DNP, Class of 2008, recipient of the Francis Payne Bolton School of Nursing Alumni Association Distinguished Alumni Award.
Hello, everybody, and good evening. I would like to thank Dr. Tom Ortel from the San Diego DNP cohort for his nomination for this award, the nominating committee for receipt of the award, my family for their enduring support over all these years as I've pursued each of my career dreams, and the professors from Case Western Reserve University who shared their knowledge with us during our time together to enhance our careers. I'd really like to call out 2 professors, even though I could speak to each and every one and what they've done to help us in our time as students at Case. First is Dr. Liz Madigan, whose curriculum course changed the way I've taught forever. When I was done with that program, I had to throw out all of my lectures and start from scratch, building curriculum with person-centered approaches to learning and interactive content. And then Dr. Debbie Lindell, whose theory class really awakened me and stimulated me to write a mid-range theory as my DNP project. That theory, facilitated sense-making, can be found on nursology.net. It was endorsed by the Society of Critical Care Medicine as just one way of organizing your work around family-centered care. I hear from nurses from around the world about the way they've used the the theory as an underpinning for their projects to advance family-centered care. So that's been very rewarding. But as you know, my work has shifted towards suicide and suicide prevention. And right now, during pandemic, we are at an increased risk of suicide. Nurses, as I found in my research, are at higher risk of suicide at baseline than the general public. But now pandemics cause anxiety, stress, panic, depression, and increased suicidality. If we do nothing, there will be an increase in suicide over this next year. So my plea to you is to use the evidence-based approaches that have been documented in the literature to reduce our risk. Mindfulness, mindfulness-based stress reduction, cognitive-based therapy, cognitive behavioral therapy type skills building, peer support programs, Code Lavender, second victim response teams, emotional first aiders, and intentional acts of kindness. Screening for nurses to detect nurses at risk and move them into treatment. Our screening program at UCSD is ready for replication. We've put it on now for 4 years, very successfully identifying nurses who need help. So all in all, right now, be kind to each other, kinder than you've ever been before. Take care of yourselves. Engage in evidence-based stress reduction practices. Recognize your colleagues who are suffering and give them a moment of your kindness. And then recognize those who are in crisis and help move them into treatment. With that, I'll say good night and thank you once again for this award.
Hi, Judy. Congratulations. It is well deserved. You show us that nursing research is not mysterious. Your large body of research deals with important clinical human questions, such as prevention of PTSD in the families of ICU patients, and most recently, the prevention of nurse suicide. You are a great role model. And again, congratulations, my friend.
I'm Kate Moore, and I am thrilled to congratulate my friend, Judy Davidson, on her award as the recipient of our Distinguished Alumni Award. I've known Judy for a number of years through our work with the Society of Critical Care Medicine, where Judy is not only a Jedi Knight Fellow of Critical Care Medicine, she is also a Jedi Master of Critical Care Medicine. It is an honor and a privilege to congratulate Judy for this very well-deserved award. Congratulations, my friend.
Greetings from Indianapolis and Sigma Theta Tau. I'm Liz Madigan, and I am delighted to congratulate Dr. Judy Davidson on this Alumni Award. Judy, you've done great work since you were my student, and I'm very proud of the hard work you've done to surface this important issue of nurse suicide and actually alternatives to what we can do to help support our staff. Especially during this time of COVID-19, where we have a hugely impacted staff, this is even more important. So from the bottom of my heart, thank you